Alberta's hospitals are crammed with COVID patients, and now a person has died waiting for care at the Red Deer Regional Hospital. Alberta Health says the patient was triaged and later reassessed by staff. It's not known whether wait times contributed to the death. There are more than 1,400 patients in hospital with COVID-19 in Alberta, a new record high. More than 100 are in ICU. Let's bring in Dr. Paul Parks. He's the president of Alberta Medical Association's Emergency Medicine Section and joined us tonight from Medicine Hat, Alberta. Thanks for your time.
Thanks for having me.
Can you give me just an idea, paint a picture, if you will, of what the hospitals are dealing with right now and how it is comparable or not comparable to the other waves of the pandemic?
Yeah, well, we're absolutely as bad as we were at the peak of the fourth wave, just in a different way. Instead of having our intensive care units overflowing with really critically ill COVID patients on vents, we have our hospital wards are overflowing with patients, and our emergency departments are overcrowded with inpatients that are admitted but have no beds to go up into the hospitals. So we have patients in hallways and in non-traditional spaces, and we're significantly understaffed. So our staffing issues are really critical right now on the front lines and in the hospital wards. So it's kind of a double whammy that's really getting us.
Talk to me about how Alberta has responded.
Well, there's AHS and the frontline workers and healthcare workers are trying as hard as we possibly can to mobilize resources and to create new field hospitals and new spaces and deploy non-traditional caregivers. But on the other hand, our government seems to be declaring that the pandemic's over and mostly sending the message that there's nothing to worry about out there. So there's a massive disconnect between what we're doing in our hospitals and seeing in our hospitals and how our government's responding.
Did you have to employ field hospitals in the fourth wave?
We had versions of them, yes, and again, though, what was different in the fourth wave was the ICUs, and so those had to be in wards and very specific and specialized equipment and skilled nursing and staff. But now it's just pure volumes, just pure numbers. We've never had this many COVID patients, and then of course we have a lot of non-COVID, very sick patients that have actually got sicker over time because of delayed care over the last 2 years of this pandemic.
So, what are you calling on the province to do? You mentioned the province seems to think that this is over. You guys maybe don't need the help that you are clearly saying you do need. What are you calling for?
Well, the first thing is just transparency and be truthful with the public so that they understand that our hospitals are actually very, very stressed and significantly burdened right now. So if you're sick, come to our hospitals and we'll take care of you. But don't be surprised that the waits in our emerge departments might be 8-10 hours. Don't be surprised that a loved one might be cared for in a hallway. Don't be surprised that we're grossly understaffed and our nurses are afraid and doing the best they can. So just start with transparency. And then, of course, if you give that message out to Albertans, then they'll also know that they got to keep on doing the simple things, washing their hands, wearing masks, get vaccinated, be careful. The pandemic's not over. So just start with being truthful and transparent with our public and let them know how desperate our situation is in our hospitals at this moment.
Where do you go from here if, in fact, you don't get a response or what you're calling for from the province itself?
Well, you mentioned our care is impacted significantly for all Albertans now. It's not just COVID patients. Now we have patients with chest pains that will wait hours in our waiting room, patients with strokes that need time-sensitive care that'll be delayed, ambulances. We frequently have ambulances not available to respond anywhere in the province because they can't offload their sick patients into our emerge departments. If we don't do something, we're just all care will be impacted. Acute health care will be impacted for all Albertans, and we're going to keep doing our best, and we're trying, and we're here to help. But the Albertans just need to know that the system is struggling, and the government has to be fair and transparent and let people know that, and mobilize resources, and take this seriously, and be frank that this wave is just as bad as the peak of the fourth one, just in a different way.
Dr. Paul Parks, we hope the province hears your calls. Appreciate you joining us on the program with your side of things.
Thanks for having me.
Health experts from around the world keeping a close eye now on an Omicron subvariant. It's called BA2. It's been reported in at least 40 countries, including Canada. We have about 50 cases, mainly from international travel. Experts say it's too soon to know BA2's impact.
There's always new variants and subvariants emerging. Not all of them are clinically important. It's just that eventually, if we keep having more and more and more changes to this virus, you are going to get a variant that's going to cause a major disruption like the Omicron variant. So what we have to do is stop this continued mutation of the virus. And the way that we do that is by stopping the number of replications and getting the case counts under control.
Dr. Labo says the way to do that is through public health measures and vaccinations.